This is One on One. Hi, I'm Steve Adubato. We are here at a very special place. This is the CHOP at Virtua Pediatric Department. I am pleased, very proud to introduce two gentlemen. If it were not for them, we would not be here right now. First, Rich Miller, President and Chief Executive Officer at Virtua, and Steve Altschuler, CEO at Children's Hospital of Philadelphia, otherwise known as CHOP. Good to see you, gentlemen.
Good to see you.
Good to see
Now,
you.
let's put where we are in context. Rich, this partnership, very powerful.
Yes.
But where we are, just as powerful. Describe it.
We're actually in Voorhees at our new hospital location, and we're in the Voorhees ED, Emergency Department. It's our partnership with CHOP, and it's fully staffed with CHOP physicians in our emergency department. So it's a very special and very unusual partnership and relationship here.
Talk about the partnership, Steve.
Yeah, so we've been able to develop a regional approach to pediatric health care. Our view is that you want to provide as much care in the community as possible. So by partnering with Virtua, we can bring many of the subspecialists, including emergency room physicians, to the community, and it provides much better access for patients. So what we've tried to do is to say at our main campus in Philadelphia, we will only have the most acutely ill patients. Everybody else we want to care for in the community. So our role is to build capacity, introduce more subspecialists to the community, and the relationship has worked really, really well.
So, Rich, in a lot of ways, for the South Jersey community, and for the community you've served for so long, what would it really mean? Be specific. For the children of South Jersey, this partnership with this extraordinary CHOP, this institution with this amazing brand, right? Mm-hmm. What would it mean for the children?
It's very important for the children because CHOP is the specialty location of choice in South Jersey. I mean, if you have the #1 children's hospital in the country in Philadelphia, and these are the Philadelphia suburbs, typically people will send kids there. I would send my kids there. So the goal here is to keep kids in this local community. It's very important where they don't have to travel across the bridge for pediatric services, and they can get them right here at Virtua. If the kids are really sick and need other support, whether it's what we call quaternary or high-level tertiary support, we'll fly the kids across the river into Philadelphia for those services.
Let's break it down a little bit. Let's talk about some of the specific services here, because sometimes, again, CHOP, for those, I was going to say for those who don't know, but that would be virtually impossible, right? Because the brand is well known. People's first reaction, for those of us who are in the North Jersey area, very often they'll think of a very well-known, very recognized hospital in the New York area. CHOP, for those in this part of the state, we are taping in southern New Jersey and Voorhees, it's top of mind. Mm-hmm. Be specific. Let's talk about some of the very specific areas, the very specific medical, clinical challenges that we are talking about that for right here at Virtua, this partnership means a big difference for parents and their children. Let's be specific.
Sure. So you can start with where we're sitting right now. You have very specialized pediatric emergency room services here. Same level, same quality that you have at CHOP main campus. You have CHOP physicians who are working in the neonatal intensive care unit.
So let's start with neonatal intensive care.
Right.
Go ahead.
So I think, as you know, one of Virtua's major programs is in women's and children's medical care. And a big part of that is they have a very large, very progressive obstetrical service. An important part of obstetrics is to provide the care for the baby once it's born. Some of them need more intensive care after births. So there's a very, very fine neonatal intensive care unit here that is staffed by CHOP physicians. There's a pediatric intensive care unit, which is a very unusual service to be available in a community hospital. So again, what we're trying to do is, as technology improves, as our clinical care pathways improve, we introduce more services into the community. So 5-10 years ago, many of the children that would have been cared for in the pediatric intensive care unit would have had to go over to CHOP. Now they can be cared for here, which is much better for the family and for the child.
And let me just add to that, Steve. I think it's important to understand that even in this emergency department we're sitting in, typically pediatric emergency departments or emergency departments in South Jersey in general, you would either see an emergency room physician or a pediatrician. And what you're seeing here, when patients come in here, they're going to see a trained pediatric emergency room physician.
Well, hold on, Richard. What's the difference?
There's a big difference in training, and the difference is that when a patient is seen by an ED physician, typically an ED physician in children has seen all kinds of illnesses and different diagnoses, different than a pediatrician, normal pediatrician would see in their office environment. So it's a very high skill set and different skill set.
I see you want to jump back in.
Yeah, I just wanted to say, to echo what Rich has said. So a pediatric emergency room physician has done 3 years of pediatric training, and then an additional 3 years of fellowship training, specialized training just in pediatric emergency medicine. So the level of skill, the experience with the type of medical conditions you would see in this ER is really different than what you would see from a pediatrician or an adult trained emergency room physician.
What does it mean to the families?
Oh, I think it's huge to the family, Steve. I know, I raised 2 girls, and I want the highest level of care for your kids. Every parent wants that. So when they come into their community hospital setting, they want to know that they have the best in breed of physician and caregivers in that setting. So this is a differentiator for parents in South Jersey. This really is. This is a place to come and to feel comfortable that you're going to get the highest level of pediatric care.
I know there are several areas, clinical areas that you focus on, particularly when we're dealing with children. Childhood obesity, a big area that's important. Talk about it.
It's huge. I mean, childhood obesity is one of the biggest problems we have in this country today. And that's another piece Steve and I are talking about, is looking at wellness and prevention in children. I mean, how do we take children before they get ill? And I think Steve, as a physician, can speak to the fact, we're seeing type 2 diabetes in children. We're seeing hypertension in children, young children
The connection
today.
directly to obesity.
Yes.
To obesity, yeah. 30% of all children by age 17 are morbidly obese.
30%.
30%, so imagine that. So, as Rich said, we're seeing children develop type 2 diabetes as early as age 4.
Mm-hmm.
So it's a critical area. And again, I think, one of the reasons I like the relationship with Virtua so much is that they're really focused on health and wellness, which is really a big theme, an expanded view of what medical care really involves. So part of what we're working on now, and that when it's developed we can bring to the community, is this notion of a healthy weight initiative.
Specific, the healthy
weight initiative. So it's specific programs to help families cope and to really, in effect, retrain them on how they have to have their kids act in terms of eating habits, exercise, things like that. Ultimately, the best way to do medicine is prevention. Right? Prevent the disease from actually happening. And obesity is one of those things, if you can prevent, you prevent a whole host of diseases in adulthood.
Let me ask you this in the time we have left. The Virtua CHOP partnership. You're trying to accomplish a lot of things here. But to what extent is this partnership potentially a model for other healthcare, hospital institutions to say, you know what, while we may be strong on our own individually, we can do a heck of a lot more for our patients, for their families together?
Well, I think there's 2 aspects. I think with the cost of care being high, Steve, in this country, you're going to need to lower the cost of care and raise the quality. And community hospitals in this setting shouldn't be all things to all people. You should look for relationships to build those relationships. We're not going to reproduce what CHOP does in this community.
You probably shouldn't even try.
Try to, when we won't. What we'll do is we'll complement each other and lean on the services that CHOP has in the quaternary and tertiary areas that.
By the way, what does that mean, quaternary and tertiary?
Quaternary and tertiary are the level of service where kids get really sick, and there's an extension of what goes on in the community and care, and that's the care that is very expensive, and frankly, you need specialty areas to really support those, whether it's cardiac, gastroenterology, specialists that we can't get in the local community that CHOP as a specialty hospital can get.
But the potential model exists.
Yes.
For others to say, hey.
Yeah. Yeah. I mean, again, the way that we look at it is it's the right care at the right place with the right provider at the right cost. 95% of what we do as CHOP can be done in the community. Virtua is a better place for us to do it than our own main campus. As Rich said, it's more cost effective. We all have an obligation to society to have the highest quality care at the most appropriate cost. And this is the model that allows you to do it.
Well, to Steve and to Rich, I want to thank you for inviting us in, to sharing the story of Virtua and CHOP coming together. It's important. It's important not just because you're helping and serving the folks, particularly the kids and their families, but for everyone else in the healthcare world. Thank you for sharing.
Thanks.
Thank you very much.
Appreciate it.
Yes.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Investors Bank, Cohn Resnick, providing accounting, tax, and advisory services for more than 90 years, the Russell Berry Foundation, Fedway Associates, Inc., PSE&G, committed to improving New Jersey's economy and strengthening its communities. New Jersey Manufacturers Insurance Group, auto insurance, homeowners insurance, and banking under the principle of stewardship. The law firm of Gibbons P.C. and by Health First New Jersey. Promotional support provided by the Star Ledger and NJ.com Everything Jersey, and by NJ Biz, All Business, All New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.